I'm going to be talking now on the complications of internal limb lengthening while using a precise nail. The complications of lengthening using a nail, there are complications which are inherent to the process of lengthening, where you can have muscle stretching, you can have pain because of the distraction, nerve dysfunction, problems with joints such as contracture and subluxation, and problems with the regenerate. Now, these are all problems of the lengthening process itself. But specific to the device, you can have issues such as pin site infection, pain, deformity which are caused due to the device or deficiencies in the device, and issues related to regenerate also, which can be related to the device. So when you use external fixation, one of the commonest issues that we have is pin site infection. There is pain because of these pins transfixing the muscles. There can be deformity in the bone, again, because these muscles are transfixed. Some muscles pull more, some muscles have more power. Whereas when we talk of internal lengthening, some of the complications that have been seen are as noted on the right side. I'll go through these one by one. So the lengthening related complications remain exactly the same with internal lengthening also, especially in congenital lengthenings, where muscles tend to be tighter. You can have things like contracture, or like this patient who developed a subluxation of the knee due to a femoral lengthening, or a patient like this where the hip is unstable, and these patients need to be treated by means of improving the stability of the related joint before a lengthening is taken up. Related to the device itself, in the early versions of the precise nail, the first generation, there was a specific weld between the motor portion and the rest of the nail, and this had been found to break in a certain number of cases. That complication has been avoided now by a change in the design. So therefore, this doesn't really happen. When you use a nail, you can get a deformity, especially when you have a large canal and a relatively thin nail, as happens in the metaphyseal regions of the proximal tibia, or if you're doing a retrograde lengthening in the distal femur. Here, appropriate use of locking screws, as shown here, blocking screws, can reduce the diameter of the canal and therefore reduce the chance of this deformity. Also, sometimes if you don't have the osteotomy at the right level, normally we want at least 160 millimeters. This is 30, 80, and 40 or 50. So a total of 160 millimeters distal to the osteotomy. Then the thicker part of the nail is in the regenerate. Otherwise, there is a chance for it to bend. In some congenital conditions, however, even despite having the thick part in the nail, there can be deformity and deviation. But this is rare. If this precaution is taken, the chance of this happening is pretty rare. One of the issues with the nail is the possibility of a failure of the mechanism of the nail, but this happens in less than 1% of the cases, and usually when they supply a nail, there are two nails of the same length which are supplied. If your distraction rate is too slow, then you can have a premature consolidation. Earlier, or some other types of nails, such as the ISKD, had a problem with what is known as runaway distraction, where the distraction would just slight movement of the limb would cause distraction. This is not a problem with the precise nail now. Just like other mechanisms, if the biology is not very good, you may have issues related to delayed consolidation. A few of the cases with the first generation of the Precise showed a reverse movement. After the distraction has been completed, there was a little collapse in the regenerate, but this probably was due to a fracture in one of the gears, mechanical failure in that gear, and this does not happen anymore. The other issues related to internal Lendeling, just like with any other internal fixation, you can have infection. One of the issues with the nail is that the locking bolts, they are threaded only on the near cortex, so that you have a thick locking bolt which goes through the nail. Now, once the distraction process is over and that distraction force and therefore the friction between that bolt and the nail is reduced, sometimes with continuous movement and the rubbing of soft tissue, these locking bolts can loosen, but they usually don't cause any trouble with the regenerate. In some patients, after implant removal, despite what seemed to be a good regenerate, there has been a fracture, which can be treated by just taking out this nail and putting in a regular trauma nail. So we've done 14 cases, 5 bilateral femurs for cosmetic lengthening and 4 tibial lengthenings for congenital causes. The first case that I did, there was a failure to distract on table. We changed the nail went back to the company, but no problem was found. So it went off uneventfully, except for the fact that, you know, I had to do a sort of extra procedure, take off that nail and put in a new nail, which was available at the time. I had one case of delayed healing that healed without any intervention because the patient wanted to wait. So we decided to wait. And eventually when the patient came back after about 3 months, he showed that it was healing. So then we didn't do anything. I'm sure as we do more cases, we will see some of the complications which I've listed here. So internal lengthening is not without complications. You need to select your patients properly. You need to preempt the complications of the lengthening process. But certainly compared to external fixation, this is a much costlier method, but no doubt that it is much more comfortable for the patient. The healing index in most studies is around 30 to 35 days per centimeter, which is much less than external fixation. And overall, the complications are lesser. Thank you.